Good afternoon, everybody. My name is Terrie Clarke, and I'm the team leader of Laura Lynn at Home. And I would just like to follow on now with the presentation. I'm sure I don't have to tell you what Laura Lynn is. It's Ireland's first children's hospice, and it was established 6 years ago, founded by Jane and Brendan McKenna in memory of their daughters, Laura and Lynn. Laura Lynn at Home was established 3 years ago and is one of the services offered by Laura Lynn Hospice. And we predominantly look after children in their own homes, but also whilst they're in hospital. So children's hospice services provide interdisciplinary care for children with life-limiting conditions. And we do this, we support the entire family, including grandparents and extended family, with specialised short breaks, practical help, advice and information, and access to other professionals within Laura Lynn like social work, chaplaincy, psychology and play therapy. We offer bereavement support and follow-up for our families. We also have 24-hour telephone support, and we offer an end-of-life care service. This is just the figures from 2016, just to show the children that were in the service. So we had 48 new acceptances in 2016, and we care for about 150 families at any one time. The figures there for the 0 to 1 year olds showed that there was 12 referrals in 2016, but I'd be interested to see what the 2017 figures are, because it certainly feels like we've had a lot more neonates and small babies referred this year. The referrals process is on the website for anyone that wants to find out a little bit more about it. We have criteria for referral, which is explained, and anybody can refer, but we just ask that parents have signed the consent form to give consent for the referral. If you can provide as much up-to-date information, medical letters, clinic letters, it all just helps with the referral as well. So this is just an example here of the care that we offer from the interdisciplinary team of health and social care professionals, and we're also backed up by a huge team of volunteers, and we couldn't actually function without them. So we offer direct care, family support, symptom management, end-of-life care and bereavement support through a variety of ways. Planned short breaks, unplanned sessions of care for symptom management, if we need to do a detailed symptom assessment for a family. We also run camps, family camps and sibling camps to support families. End-of-life care, we can offer end-of-life care both in the child's home, at Laura Lynn Hospice, or in hospital. We can become involved there as well. Again, as I said, anybody can refer, but we just need the parents' consent. I'd just like to talk to you from my case study about a little girl called Terrie. And Terrie was a little baby who was born in 2016. So just use the timeline formula as well. So Terrie was born, everything appeared well. There were no issues at birth. She was discharged home on day 2 and just had ongoing issues over the first couple of weeks of vomiting, a little bit of reflux, secretions and breath holding. She had a couple of attendances in ED, but there was nothing significant noted, and she was discharged home. She returned to ED on the 23rd of September when she was almost 1 month of age. And after a few days of being admitted, she deteriorated suddenly, and unfortunately she was discovered to have hypertension and a raised fontanelle, so she was intubated and transferred to intensive care. And she had a number of investigations performed there, like she had an MRI and a CT, and a solid mass was identified in her right hemisphere, and biopsy confirmed the presence of a hemispheric medulloblastoma with spinal mets. So she was intubated and ventilated at that stage, and she had an external ventricular drain in situ. Obviously, the shock of this news was a lot for the family to take in. It was hugely important that communication was very effective and that the parents understood what they were the information that they were given. After communication between the team and the family, a decision was made that Terrie would be for comfort measures, as it was futile to treat this condition and would not be in her best interests. The family were then given time to consider what they might like to do. Terrie was referred at that stage to the clinical nurse specialist for life-limiting conditions, and she was also referred to Laura Lynn and to Jack and Jill. And a decision was made by her family that they would like to bring Terrie home to her sister to spend some time together as a family. This required a huge collaboration. It was obviously done very quickly because time was of the essence. And so there was a lot of people to be involved. The team in Temple Street liaised with Dr. Mary Devons for advice on symptom management. She was also referred to the specialist palliative care team, St. Francis Hospice in Raheny. The GP, the public health nurse, the pharmacy were all involved, and Bumbulance was involved to bring her home. So the Laura Lynn at Home team met Terrie the day that she was discharged home. We were there when the family arrived home, and we would sometimes we would go into the hospital and meet the family, but it wasn't appropriate on this case because there was a lot more going on with other professionals meeting the family. But we would often go into the hospital first to meet the family. So a team of nurses were allocated to Terrie to look after her for the following few days. It's very difficult in this situation to know how long you're talking about and what kind of level of care you can continue to provide. The first few days are usually quite easy to manage, but as time goes on, it can become harder to cover. So we would have liaised very much with Jack and Jill, and between Laura Lynn at Home and the team from Jack and Jill, we were able to offer this baby almost 24-hour care at home. And this was something that the family really needed and wanted. We weren't sitting with the baby all the time, but we were allowing the family to have family time together, and it was actually lovely that Terrie got to spend a night in bed with her big sister. And we were just there in the background when there were issues or if the parents had concerns or needed help with anything. Obviously, they were new to tube feeding and giving medication by tube as well. Terrie had a syringe driver in situ, which was cared for by the team from the St. Francis Hospice. Sadly, Terrie died after 4 days at home. One of the things that we offered the family and that they were very grateful for was memory making. This can be offered at any time, either before the child passes away, and sometimes it's offered after death as well if the family so wish. It allows the family to continue to engage with their child in a meaningful way, and it can be one of the last activities that families will do as a family together. This can be offered. We've often gone into hospital to do this as well for families, so it's something that we can bring with us. It's a very poignant picture of the one with the little hand and the ring, because the day that Terrie was discharged home from hospital after she was born, her parents got engaged. And this is a picture of the engagement ring, so it was very precious to them. I just have a couple of examples here. If I break these, Fiona will kill me. These are just to show you in reality what they look like, because it's very difficult to demonstrate in the pictures, but these are little casts of the hands and feet that we would have taken moulds of and then painted and framed. And it can often be a special theme that the family have, or something that's very important to them, like some families we've had that like the beach or the park, or it may have been a memory of a holiday or something that they want to incorporate. So it's really family led, and we just facilitate it, but the feedback and the impact of it on the families has been huge. So during the time of looking after Terrie, obviously there was a huge amount of professionals involved in a very short number of days. So communication again was a huge big factor, and just trying to keep everybody in the link, trying to find out what other services we're offering so that we weren't duplicating things and making it working relationships, keeping them running smoothly. And it is a very important factor in a case like this where you don't have much time to plan, but Gail has done a fantastic rapid discharge plan, which really helps, I think, when we're dealing with this. Thank you.